Hello everyone and welcome to this class on the frontal bone. Here in the picture of the skull you can see the frontal bone in blue, and you can make out that it forms part of the forehead, which is common to the face and the scalp. So it is the support for the scalp, for the vault of the skull, face, part of the base of the skull, the root of the nose, and you can see that it forms part of the orbital margin. Over here you can make out that it forms the roof of the orbit, and at the sides this part forms a part of the floor of the temporal fossa. So this is the temple, this is the scalp, this is the forehead, and this is the face. And again, if we go to this picture, you can make out again the frontal bone at the root of the nose, the roof of the orbit, the temporal region, that is the part of the temple, the temporal fossa, the vault of the skull, the forehead, and the brow region. And again in this picture you can make out this is the base of the skull, the dotted part outlines the anterior cranial fossa, and again you can make out that the orbital plates of the frontal bone, these two in blue, they are forming the floor of the anterior cranial fossa, at least most of the floor, along with the ethmoid and the part of the body and the lesser wings of the sphenoid. And so all of this is the domain of the frontal bone. The part over here, the part over here, and the parts over here. Now if we look at the frontal bone again, you can also make out that it is hollow, and here within the frontal bone, just above the orbital margin, you have the frontal air sinuses, and you can make out the frontal air sinuses here, and you can make out the frontal air sinus here. And after all this, you can make out in this diagram also, this is a sagittal section of the skull. Here again you can make out the frontal bone, the squamous part of the frontal bone extending up into the vault of the skull, and you can make out this hollow part within the frontal bone above the orbital margins. This is the frontal air sinus, and you can see the nasal notch here forming part of the nasal septum, and on the sides forming part of the roof of the nose. And although this is a midline section, so this jutting up part is the crista galli of the ethmoid, but on the sides you can again make out the orbital plates of the frontal bones forming the floor of the anterior cranial fossa. Now, having seen the frontal bone in so many aspects, let us actually go to the parts of the frontal bone, as you might be asked in the exam. Now this is the squamous part of the frontal bone, and over here you have the nasal notch and the nasal spine. This is another part of the frontal bone. You can see a little bit of the orbital plates going horizontally behind. This is the orbital plate of the frontal bone, and from the front this is all that you can see of the frontal bone. The rest of the frontal bone you have to see from here. So when you hold the frontal bone in anatomical position, you have to hold the orbital plates horizontally and the squamous part of the frontal bone vertically extending up into the vault of the skull. And here again in the front squamous part of the frontal bone, we are going to first look at the articulations. So this margin of the frontal bone is called the parietal margin of the frontal bone. It articulates with the parietal bones forming the coronal suture, and below over here to this last part of the parietal margin you have a triangular area behind this zygomatic process. Behind this zygomatic process you have a small triangular area which is in continuity with this parietal margin. That small triangular area articulates with the greater wing of the sphenoid. The zygomatic process itself, this strong buttress of bone over here and here, the zygomatic process of the frontal bone articulates with the frontal process of the zygomatic bone, forming over here the frontozygomatic suture. If you look at this external surface of the frontal bone as a whole, at the supraorbital margin, at the junction of the medial 1/3 and lateral 2/3, you can make out the supraorbital notch, and on this side the supraorbital foramen for the passage of supraorbital vessels and nerve. Further medially somewhere here you have the passage of the supratrochlear vessels and nerves, although they do not cast any markings. A little bit above the orbital margin over here there is a bony prominence which is called the superciliary arch, and in between the superciliary arches of this side and this side, in the middle there is a smooth featureless area which is called the glabella. In the living person this is more or less a hairless area between the two eyebrows, and above the superciliary arches you can make out two prominences here and here. These are called the frontal tubers or the frontal eminences, and these are more prominent in females. And not only that, between the frontal eminences you can make out here a trace of the metopic suture, which actually represents the bilateral ossification centers and their union in the middle. So these remnants of the metopic suture may persist in a few individuals. As far as muscle attachments are concerned, you have a little bit of attachment of the orbicularis oculi over here and the corrugator supercilii over here, which are mostly attached to the subcutaneous tissue of the face. And not only that, if you come to the sides over here, this zygomatic process is, the zygomatic arch is continuous above over here with the superior and inferior temporal lines, two curved lines passing over by the sides of the squamous part of the temporal. Now this region of the squamous temporal forms a floor of the temporal fossa. So to the superior temporal line over here you have the attachment of the temporal fossa, and to the inferior temporal line you have the attachment of the temporalis muscle itself. Now this whole thing forms the supporting bone underlying the scalp. So you have the scalp tissues over here, the galea aponeurotica or the epicranial aponeurosis of the scalp, anchored by the frontal belly over here, the frontalis muscle, and the occipital belly behind on the occipital bone. So these frontalis muscles here do not have a bony attachment, they are attached to the subcutaneous tissues, so we are not drawing them on the bone, but the epicranial aponeurosis does have an attachment again on the sides to the superior temporal lines, and not only that, it gives a thin prolongation over to the zygomatic arch. Now from this external surface we will go to the internal surface. On the internal surface you can make out, now in anatomical position this part would be vertical and these orbital plates would be horizontal. So you have the orbital plates here, you have the interior of the squamous part of the temporal over here, you have this U-shaped ethmoidal notch over here, and this irregular nasal notch and nasal spine. So here you can make out the orbital plates, the interior of the squamous part, the ethmoidal notch, and the nasal notch and the nasal spine. All of these are quite evident over here. Now inside you can make out the sagittal sulcus in the midline, the margins of which give attachment to the falx cerebri, and in between the attached margins of the falx cerebri to this sagittal sulcus you have the superior sagittal sinus, and on either side you can make out impressions of the gyri of the frontal lobe of the brain. And this sagittal sulcus, when it comes down towards the ethmoidal notch, it forms an elevation which is called the frontal crest, and into this frontal crest is also attached the falx cerebri, and when this frontal crest comes down to the ethmoidal notch, almost at the junction of the ethmoidal notch and the frontal crest you have a small opening which is called the foramen caecum, and this foramen caecum transmits a connecting vein which connects the superior sagittal sinus to the supratrochlear or to the supraorbital veins and the veins of the nose. So you have a connecting vein with the veins of the nose and the superior sagittal sinus over here. And on either side, as we have said, you have impressions for the gyri of the frontal lobe of the brain, and these markings are of the meningeal vessels. So that is all in this part. Now we will come to the next part where we will discuss the remaining parts of the frontal bone.